CNA Qualities of Excellence. Welcome to the quiz. Question 1. You are assisting Mrs. Ruby Edwards, a 76-year-old female patient who has some difficulty swallowing and is dependent on you for assistance with oral hygiene. She has some confusion and is unable to perform oral care for herself. You want to ensure her mouth is clean while preventing aspiration and other complications. Before assisting a patient with oral hygiene care, what important assessment must you perform? Option A. Assume all patients can swallow and tolerate oral hygiene care without any concerns. Option B. Place the patient flat on their back in bed, as this is the easiest position for providing oral care. Option C. Check for any swallowing difficulties, assess the patient's ability to protect their airway, and position them upright or semi-upright to prevent aspiration. Option D. Use whatever oral hygiene products you have available without considering the patient's specific needs. The answer is C. Before oral care, assess swallowing and airway and position upright to prevent aspiration. Option C is correct. Options A, B, and D are unsafe. Question 2. You are assisting Mr. Francis Turner, an 85-year-old male patient who requires maximum assistance for transfer from bed to chair. He weighs approximately 220 pounds and has very limited mobility. He needs help to move safely without injuring himself or the healthcare workers assisting him. Based on safety principles for patient transfers and the importance of using appropriate equipment, which piece of equipment is most appropriate for a patient requiring maximum assistance with transfer? Option A. A walker would be appropriate as it allows the patient to transfer independently. Option B. A mechanical lift device is the most appropriate equipment for safe transfer of patients requiring maximum assistance. Option C. A cane would be sufficient for this patient, as it provides adequate support. Option D. No equipment is necessary. Manual lifting by staff members alone is the safest approach. The answer is B. For patients requiring maximum assistance, a mechanical lift is the safest option. Option B is correct. Options A and C are for independent or minimal assistance. Option D. Manual lifting is high risk. Question 3. You are working on a psychiatric unit and are caring for Mr. Vincent Ryan, a 45-year-old male patient who has a diagnosis of major depressive disorder. During your evening shift, he tells you that he has been having thoughts about wanting to hurt himself and that he does not believe his life is worth living. He appears hopeless and mentions specific plans about how he might harm himself. You understand this is a serious situation. Based on proper procedures for responding to patients expressing suicidal thoughts, how should you respond? Option A. Tell him that these feelings will pass and that he should not worry about them. Option B. Explain to him that suicide is morally wrong and that he should not have these thoughts. Option C. Remain with the patient, provide reassurance and support, and immediately notify the nurse and other appropriate personnel so that appropriate evaluation and safety measures can be implemented. Option D. Document his comments in the chart and address it with the patient later after you have finished your other tasks. The answer is C. Suicidal ideation requires immediate intervention. Stay with the patient, provide support, and notify the nurse/crisis team. Option C is correct. Options A and B dismiss his feelings. Option D delays critical action. Question 4. You are working on a unit where several patients have infectious diseases and are on various types of isolation precautions. You are learning about how to identify when isolation precautions should be discontinued. One of your patients has been in contact/droplet precautions for respiratory infection. Based on standards for infection control, when should isolation precautions be discontinued? Option A. Isolation precautions should be stopped when the patient requests them to be discontinued. Option B. Isolation precautions should be discontinued when ordered by the nurse or physician based on test results, clinical improvement, or time-based criteria specific to the organism. Option C. Isolation precautions should automatically be stopped after 1 week regardless of the patient's condition. Option D. Isolation precautions should only be stopped when the patient is discharged from the hospital. The answer is B. Discontinuation of precautions is a medical decision based on specific criteria. Option B is correct. Options A, C, and D are not appropriate. Question 5. You're assisting Mr. Henry Martinez, a 75-year-old patient, with ambulation in the hallway. You are supporting him with a transfer belt around his waist for safety. Suddenly, he tells you he feels dizzy, loses his footing, and begins to fall toward the floor. You realize that you need to respond immediately to prevent a serious injury. Based on appropriate response to a patient who is falling, what is the most appropriate action? Option A. Quickly grab the patient to stop him from falling, as this is the most important action. Option B. Remain calm, try to break the fall and slow his descent if possible, ease him to the floor gently if a fall cannot be prevented, and call for help immediately. Option C. Wait to see if the patient can catch himself and get back up on his own. Option D. Move the patient immediately after he has fallen to get him off the floor. The answer is B. When a patient falls, do not try to catch them, risk injury to both. Instead, ease them to the floor, protect their head, and call for help. Option B is correct. Option A may cause injury. Option C is dangerous. Option D. Do not move a fallen patient until assessed. Question 6. You're assisting Mrs. Violet Thompson, an 80-year-old female patient who wears dentures. She is unable to care for her dentures independently due to arthritis and mobility limitations. Her dentures are not currently in her mouth. You need to properly store her dentures. Based on proper denture care and storage, how should dentures be stored if a patient cannot wear them? Option A. Leave the dentures on the bedside table without any cover or container. Option B. Place the dentures in a labeled container with water or denture solution to keep them moist and prevent damage and warping. Option C. Put them in any available cup with tap water without labeling or specification. Option D. Keep the dentures in the patient's pocket where they are easily accessible. The answer is B. Dentures must be stored in a labeled container with water or solution to prevent drying and damage and to avoid loss. Option B is correct. Options A, C, and D risk damage, loss, or contamination. Great job! Don't forget to subscribe. Bye!